Is it recording? All right, so I don't know. A video got interrupted, but let's start back at the tell me where you feel in your hand, okay?
30.
All right, and uh, what's in your hand?
Cell phone.
Okay. Cool beans. Okay, now I'm going to rate your reflexes, okay? And we're gonna do the bicep one. So flex your arm for me. Okay. Flex it in. Okay, yeah, that's what I'm trying to look for. All right, what I'm gonna do is I'm gonna hit it, and
You should
I know I'm supposed to hit myself.
hard.
No, no. I'm gonna hit you. Okay. Now I'm gonna do the tricep. Just relax. I'm gonna hold your arm. That's fine. Flex it. Okay.
I was scared. I was scared. Okay. I'm not gonna look.
Okay, I saw the contraction. Okay. Now I'm gonna do your brachial, radial. Okay, okay, okay. I saw it. I saw it. Next, I'm going to inspect and palpate your posterior chest. Oh no, I did that already. No, I didn't. We stopped at the. Okay. Where did we stop at?
We just did the hand
Okay, so I'm gonna do the anterior chest. Okay, so that's where we're gonna start it. So not gonna expose you, but I'm just gonna look at the top of your chest. All right, skin is equally distributed, no discoloration. Now I'm gonna feel it. Any pain?
No.
Okay. Your work of breathing was unlabored. Your chest is symmetrical when it expands, and I'm gonna also take your heart sounds. Okay.
Okay.
All right. I heard S1, S2. Love dub in all the heart sounds location in the aortic, pulmonic, mitral, and tricuspid areas. Um, I'm gonna inspect the skin of your abdomen. All right, no discoloration. Looks good. And now I'm going to, it's symmetrical. I can see your line from when you hit your head. Everything looks good. No problems noted on your abdomen. Yeah, there you go, right there. So when you get pregnant
I thought you
again,
meant my could.
oh no. And so, okay, now I'm going to, your umbilicus look good, no signs of a hernia as well from looking. Now I'm going to auscultate your bowel sounds, okay? And I'm going, after I finish auscultating your bowel sound, I'm going to head auscultate your aorta and your bilateral renal arteries. Okay. Vowel sounds are present and audible and active in all four quadrants. I can hear your heart, well, your pulse through your arteries. Um, gonna palpate your. Okay, I'm gonna do a light palpation and a deep palpation of your quadrants as well. Okay. Lightly. Oh, I'm sorry, I forgot to percuss. I will percuss before I palpate. Okay, now I'm going to palpate. Okay, deep palpation. No pain? Alright, no tenderness, no guarding. It's noted. And now I'm going to assess your lower extremities. Are you ready? Okay, so pull your leg up. Alright, I see your skin is a little dry. So it's fine though, but I understand. Just got out the shower. No edema noted. I'm gonna feel your legs. No scarring. No redness. Okay. Palpate your pulses, okay? Start with the popliteal. Alright. Now I'm gonna do posterior tibia. Okay. Dorsalis pedis. Okay. Pulses are good and strong. Now I'm going to turn around to the back and see that you don't have any edema on your ankles, so no, everything looks normal. So no tibia edema noted. Now we're going to, you can lie down. We're going to do a little range of motion of your hip, leg, and knee. Raise your right leg 90 degrees. All right, left leg 90 degrees. Bend your knee to your chest. Okay, rotate your hips by pointing the knee in and out. Okay, so just go like left. Good. Okay, and now we're going to abduct your leg and abduct your leg. So yep, in, good. Okay, range of motion of your feet. Okay, I just want to make sure the camera still can see us. Okay, so push like you pushing the gas. All right, now like this, in, out. Push like you're pushing the gas. Against resistance. Against resistance. Good. I feel like that was a workout. All right. Now we're gonna sit in the chair, and I'm gonna do your patella and your Achilles. Sorry, you're fine. We're gonna try this. Make sure it works. Okay. Okay. Good. That was perfect. I must hit it right on the tendon. Okay. So I'm gonna do that. Your Achilles, and it's at the back. Are you ready? Okay, I saw it that time. And now, okay, good. Babinski and Achilles and patellar reflexes. So let me do it on this side. All right, I saw it on that one. It's not as good as the other side. Let's do. Okay, I saw the contraction on that one. All right. You did good on all your reflexes. And now, I want you to stand up, continue to stand up, and take your right heel and rub it down your left leg, starting at your knee on down, okay? And do the same thing for the opposite. Okay, now I want you to walk on your heels. All right, walk back. Okay. You walked on your heels forward and you walk back on your toes. Good. Okay, we just get it all out the way, right? Okay, now, okay, I see that you're standing. So, wrong bird, you're balanced and everything looks good. Okay, now I'm going to ask you to hop on one leg. Okay, hop on the other leg. Good. Now I'm going to inspect your spine and ask you to do a couple things. All right. Now I'm going to palpate your spine, okay? All right. Bend down, touch your toes. All right. Bend to the side. Bend to the other side. Bend backwards. Twist. Good. Okay. And we're done with the assessment. Now on to the teaching. So I'm going to teach you about asthma. I know you had the childhood illness, and okay, so can you tell me what asthma is to you? What you think it is?
It's a breathing disorder where you can't get enough air into your lungs.
Okay, good. That's a good description. So asthma is a disease that affects your lungs, as you stated, and it causes episodes of wheezing, shortness of breath, chest tightness, and so what it is your bronchioles. It's like, this is like your normal airway. It's like a hole within a hole. So I think about like those straws. So you have the normal airway, and then somebody who has asthma, their airway isn't as open there, and then when you have an asthma attack, it's really small. So that's basically how it is right there. And you know, with asthma there comes triggers, there's causes, there's symptoms. So we're gonna talk about some symptoms, and we could say wheezing. Can you name another one?
Wheezing,
Coughing. Then you know, your chest get tight.
Oh, yeah.
And then you have shortness of breath. And some triggers of asthma. And you know, asthma varies per person. Some people have mild, some people have moderate, some people have like extreme asthma. So you have viral illnesses such as the common cold can trigger it. You have allergens, like allergens. You have exercise, environmental conditions, medications, and smoking. Other triggers such as like pollen, cockroaches, mold. The weather actually can be a thing, but you know, like pollution, environmental conditions. That's all a part of that. What exactly triggers your asthma?
Cats, dust, and smoking.
Okay. So how you can control your asthma is you have to know what triggers, and I see that you already know, so I'm sure that you do a good job at avoiding and limiting the exposure that you have to those triggers. Also, you need to know when to take your medications. I know you're currently not on medications now, but let's just say your baby has asthma in the future, since you had asthma as a child. You know when to take a breathing treatment, give her a breathing treatment, or know when she needs to puff her inhaler and stuff like that. another thing is people will have an inhaler, but they don't know how to use it. So you need to know how to use. Make sure you inhale when it depending on what kind of inhaler you have. Shake it up. Inhale while you puff. Inhale while you like hit the thing. That's what I meant. Spray. Yeah. So, basically know your symptoms. So you know a good deal about it, and you're very healthy from the assessment and from your health history, and I just want to commend you on that because not everybody is. And just continue on your health journey. And do you have any questions in regards to your assessment or asthma or anything?
No, you were great.
Thank you. But thank you for participating in my checkoff, and I appreciate you.
Yes, ma'am.